Sat Sri Akal ji, welcome to the first episode of ACE the NCLEX with ACE Nursing. So आज ਆਪਾਂ ਗੱਲ ਕਰਾਂਗੇ बहुत important topic बारे which is heart failure. So what is heart failure? Heart failure means heavy fluids. So this is the first word ਜਿਹੜਾ ਤੁਹਾਡੇ mind 'ਚ ਆਉਣਾ ਚਾਹੀਦਾ. Heart failure, heavy fluids. So ਮਤਲਬ ਕੀ ਇਹਦਾ basically ਤੁਹਾਡਾ heart ਜਿਹੜਾ ਹੈ ਚੰਗੀ ਤਰ੍ਹਾਂ ਕੰਮ ਨਹੀਂ ਕਰ ਰਿਹਾ, ਬਹੁਤ weak ਆ, tired ਆ, it's failing to pump. So ਆਪਣੇ heart ਦਾ ਕੰਮ ਆ pump ਕਰਨਾ. So it's failing to pump ਉਹਦੇ ਕਰਕੇ blood ਜਿਹੜਾ backup ਹੋਣਾ ਸ਼ੁਰੂ ਹੋ ਜਾਂਦਾ ਹੈ, either in the lungs or in the body. So ਜੇ ਤੁਸੀਂ blood flow ਸਮਝ ਲਓ heart ਦਾ, heart failure ਨੂੰ ਸਮਝਣਾ ਹੋਰ ਵੀ easy ਹੋ ਜਾਂਦਾ ਹੈ. So left sided heart failure basically ਆਪਾਂ ਕਿਹਾ ਸੀ lungs 'ਚ backup ਹੁੰਦਾ ਹੈ. ਕਿਉਂਕਿ left side ਜਿਹੜੀ heart ਦੀ ਆ ਉਹ body ਨੂੰ pump ਨਹੀਂ ਕਰ ਪਾਉਂਦੀ ਤੇ ਇਸ ਕਰਕੇ lungs 'ਚ backup ਹੁੰਦਾ ਹੈ. So L for left sided heart failure, L for lungs. So the blood is backing up in the lungs. Right sided heart failure it's backing up in the body ਕਿਉਂਕਿ right side ਜਿਹੜੀ ਆ heart ਦੀ ਉਹ fail ਹੁੰਦੀ ਆ pump ਕਰਨ ਦੀ ਸਾਡੇ blood ਨੂੰ to the lungs. So that's rest of the body, right sided heart failure. So remember that. Okay, so left sided heart failure and right sided heart failure, these signs and symptoms are very important for the exam. So left sided heart failure the lungs to back up on that, L for left, L for lungs. So lungs which back up on that, so the signs and symptoms or they related there. So dyspnea, shortness of breath, crackles in the lungs, pulmonary edema, you're gonna see pink frothy sputum, and orthopnea as well. So orthopnea means so that's why they have to sleep with pillows at night. So right sided heart failure, blood is backing up in the rest of the body, R for right sided, R for rest of the body. So ਇਹਦੇ ਵਿੱਚ ਕੀ ਹੁੰਦਾ ਹੈ, ascites ਹੁੰਦੀ ਹੈ. Ascites means fluid accumulation in abdomen, swelling ਹੋ ਜਾਂਦੀ ਹੈ, edema, then you're going to see weight gain, JVD, jugular vein distension. So these are the main signs and symptoms of right sided heart failure. Body ਦੇ related body 'ਚ ਹੁੰਦਾ ਉਹਨਾਂ ਨੂੰ, left sided lungs 'ਚ. So diagnostic and treatment. So one of the major diagnostic tests for heart failure is BNP. So BNP, ਜਦੋਂ ਵੀ ਤੁਹਾਡੇ question ਜਾਂਦਾ ਹੈ, think of heart failure right away. 100 ਤੋਂ ਜ਼ਿਆਦਾ BNP ਹੋਵੇ, that means the patient has heart failure. Number one treatment for heart failure is diuretics. The medications ਜਿਹੜੀਆਂ end ਹੁੰਦੀਆਂ iodine. So for example, furosemide, ਇਹ help ਕਰਦੇ ਤੁਹਾਡੀ body 'ਚ fluid reduce ਕਰਨ 'ਚ. So make sure diuretics ਜਦੋਂ ਵੀ ਆਪਾਂ patient ਨੂੰ ਦੇਣੇ ਆ, morning 'ਚ ਦੇਣੇ ਆ, and monitor potassium loss. Some diuretics like loop diuretics, they can cause potassium loss, so monitor the potassium for this patient. The second thing is we will give them digoxin. Digoxin increases contractility. Heart failure ਜਿਹੜਾ ਦੀ heart ਦੀ contractility ਘੱਟ ਜਾਂਦੀ ਹੈ, basically the strength of the heart contraction. Heart ਜਿਹੜਾ weak ਹੁੰਦਾ ਹੈ, pump ਨਹੀਂ ਕਰ ਪਾਉਂਦਾ, so digoxin ਉਹਦੀ contractility ਵਧਾਉਂਦੀ ਹੈ, strength ਨੂੰ ਵਧਾਉਂਦੀ ਹੈ. So digoxin is a very important drug that you need to remember for exams. So digoxin, always make sure you're monitoring for toxicity, and before you give digoxin, check the apical pulse for full 1 minute. These are some of the NCLEX tips that you need to remember. Patient education for heart failure, tell them to weigh themselves daily, same scale, same time, same clothes. Report increase in the weight. And one thing to remember is you do not give NSAIDs like ibuprofen and calcium channel blockers to patients with heart failure, because heart failure the symptoms nu vada sakte hain. So now you know this topic of heart failure, the meds, and how to teach. Follow ACE Nursing for more topics like these. Let's ace this NCLEX together.